You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Chiropractic Rocks, True Weight Solutions, The 100-Year Lifestyle, Pure Chiro Notes, Titronics, Passive Practice Profits, BrainTap Technology, Sherman College of Chiropractic, SCED, ChiroPro Accounting, A-Line, and Midwest Brain Health Technology. Let's hustle!
Hey guys, welcome to episode 253 of the Chiro Hustle podcast. I am your co-host Luke Millette, and here's your host Jim Chester.
So today we had the opportunity of interviewing Dr. Mike DeCubellis, and if you want to know more about the art of chiropractic, technique, and business, stay tuned. Hello everyone, welcome to another episode of the Chiro Hustle podcast. Today we have Dr. Mike DeCubellis coming in from Downers Grove, Illinois, and Luke and I are coming in from the beautiful state of Colorado in a little city called Grand Junction. And we're just really happy to have Dr. Mike on with us today. Welcome to our show.
Thanks for having me.
Yeah, there's a lot of chiropractic talk we're going to have. I should probably call these TikToks, but we call them hustles. So one of the first questions we like to ask is most people don't know really your story, and they don't know a lot of people chiropractor stories of how they got into the profession. Some people are like, yeah, I'm second generation, or I was in like a college football thing, and but I'm really curious, what is your chiropractic story and how did you get into the beautiful profession of chiropractic?
Yeah, so I come from a long family of chiropractors. Two of my uncles are chiropractors. I'm a chiropractor. My brother's a chiropractor. 2 cousins are chiropractors. But I just realized the power of it and kind of that I was interested in it. There was a time in high school, middle school where I would go because my uncle was right in the hometown, and I would get adjusted, regularly. And for about a year, I was getting adjusted regularly. I didn't necessarily have any issues going on, but I just went in. And then thinking back, I was like, man, it's really weird. I didn't get sick that whole year. That's kind of strange, And then as I was progressing, I originally thought I wanted to be either a vet or I wanted to be a pediatrician. But I started looking at chiropractic because I said, when you're dealing with vets, I watched a video and they had to put their hands in and replace a cow's stomach and move it. And I said, it's just not for me. And pediatrician, I didn't like that while I was dealing with children and can potentially help them. It was like a one-off. Like they come in, I write a note or a prescription for something, and then I never really know how they improved. I'm not being able to monitor. I'm not part of their healing process. So I decided, you know what? I really like how chiropractic is that kind of hands-on, hand-holding approach to where we're working on and we're getting people to be able to heal and restore proper functionality. And it just kind of had me sold.
Yeah, I think there's something to be said about that. And that's it's pretty impressive, man. You come from a pretty strong chiropractic family. I had no idea.
Yes. Yes.
So who was your first chiropractor then? Was it a family member?
Yeah, it was my uncle. He went to school. I had 2 uncles who were chiropractors, but one of them was about 2 hours south. So yeah, my uncle was my first chiropractor, and that's where I was really introduced to it.
So it's a family deal. I love it.
Yep.
And now you've been practicing for, I think you said 13 years?
Yep.
And you said you grew up down in Florida, and now you're up there in the Chicagoland area.
Yes.
Tell us a little bit about that journey.
Kind of interesting journey. So I grew up in Florida, went to my undergrad at University of Florida, went to Palmer, Florida to get my chiropractic degree. And then since I had grown up in Florida all my life, I wanted to try somewhere new. So originally moved to Missouri, thought that it might be, where I wanted to end up. Wasn't really the best place at the time to practice just based on what was going on there in the economy. So I kind of went on a nationwide search, went on interviews all over the country, and went on an interview at a place in Chicago. Really liked the way the guy had it lined up. I liked his philosophy. I liked what he did. So I took the job there, worked there for 6 months. He owned a couple different clinics. I was going to be his newest clinic. He was working there, and he wanted to kind of transition off and have me be the clinic director there. So I took that job, started working there for 6 months. And then he walked in on a Friday and said, just so you know, as of today, I'm closing the clinic down. But if you want to take over, I've paid for the next month's rent, so you can go ahead and take that, and I'll just sign the lease over to you. And it was a little shocking because I wasn't expecting that. And so I basically had a month to try to get everything up and running, and that was 13 years ago.
So off camera, you mentioned that you've been on some other health-related podcasts previously. What
Yes.
are some other programs you appeared on?
I've done a couple different ones. I, of course, can't remember the name off the top of my head. And then I've also been doing a few myself. I guess they're called podcasts, where I kind of go around, and it's more kind of local business related, not so much health related. But yeah, just different topics. I've also done a couple with some personal injury attorneys in the area, talking about how personal injury cases are a little bit different than your typical, back pain case, and what we deal with not only patients, but how the attorney and the doctors work together. So I've been kind of doing a little bit of all that.
That's pretty cool. I mean, I didn't know that. And you've been building the bridges with local community.
Yep.
I think that's one of the most powerful things anybody could do when it comes to becoming a business owner in 2021, is to reach back and to connect with their local communities.
Yeah. And it's been kind of nice and kind of fun too, because I'm getting to talk with people that, typically I wasn't talking with before. But the way I kind of did is I started out saying, you know what, let's target some of these small businesses that were really impacted during everything that happened last year. And I want to ask them some questions that I know I'm curious about, that I think other people would be curious about too. Like we did one with a local restaurant owner who owns 2 restaurants that are, within walking distance of my clinic. And he had opened his second restaurant 2 days before we got shut down. So for him, I just kind of talked and said, wanted to know how did he get through it? How is he even finding updates? What was he doing with his staff? And he's more of a fine dining, higher class type of meal. So I said, how is that transition to when people are going to get to go? Because, people typically aren't going to want to order, scallops in a styrofoam thing to go. So we kind of talked about what changes he had to make, and different things he was doing there. And, not only helping spotlight his business, but it's just interesting. And I think people didn't know all of that stuff. And then talking about how the community really was able to kind of help him and rally behind him, and how thankful he was for all that.
Yeah, that's really cool. Have you noticed that it's helped with the local businesses that you've reached out to?
I mean, it's definitely helping with their spotlight. I know, like with his video specifically, I was tracking it, and just on my end where I shared it, we had 700 views in a week, which was pretty cool. And I know on his end, he said he got a ton of views too. I don't know what his specific number was, but we got a lot of comments. People were going in there. And then some of the other places we did too, like I interviewed the manager of the local Trader Joe's. Because the other thing I thought was interesting is, let's talk about from a grocery standpoint, like what they had to go through with stocking and trying to change aisles and all the different policies, and, keeping people staffed, and, also too, like what new things happened, like what innovations did you have to come up with, and what products sold that you were surprised of, or with the restaurant owner, what new meal did you come up with, or they started doing cocktails to go, which was an interesting concept. So how does that work? How do you come up with those? How do you find the containers? Just to me, it was a lot of interesting information, and people seem to really, really like it. So I've just been kind of happy to be able to do that.
Yeah, I think we've all had to think a little bit outside the box and see how we could actually do a little bit better for each other. And have you noticed by doing that, did that help boost your growth with patients or new patients, or people doing referrals for you?
I will say that with doing this and some of the other stuff I've been doing, the thing that's been kind of interesting is when people have been coming in or as new patients, or even my current patients, they are mentioning that they're seeing me, or, new patients, they already know what I look like before they come in, which is kind of cool. Because I make sure, when I do those things, I'm not overly trying to promote myself. I'm really trying to help the other business owner. But that's what's been really interesting is people already have that kind of friendliness when they come in toward me, because they kind of have already seen me. They've heard my voice. They've seen me interact with someone else they know. So that's been kind of interesting, having that already almost like familiarity. And then having patients come in and say, oh, I watched that interview. That was great. And so that's really been cool.
Yeah, that's what I hope happens with people that do this type of community outreach is familiarity in the market and people knowing you before they know you.
Right.
I think that's a really cool thing. Luke and I teach people how to upstart podcasts. And one of our zones of genius is teaching people how to go in their 7-mile bubble and go out there and find people that they can network with and, put a spotlight on their business and promote them and do it the right way. And I think that that's something a lot of people just need some training on. And if it was done the right way, like what Luke and I teach people, people could have a greater impact on what they're doing and build their network quicker. And I think that if you're very strategic about doing these types of spotlight interviews on other people that are running businesses, it's a good way to cross-pollinate your brand into other people's life. And everybody's watching something. Why shouldn't they watch Chiropractor talk about something? And I think that it really makes a lot of sense to me what you're doing. So congratulations for doing that. I know it's a lot of extra work.
Thanks. Yeah, but it's fun.
So what are some mantras that you live your life by, or maybe what are some of your favorite motivational quotes that keep you fired up?
One thing that I always kind of like to say when it comes to, especially like kind of a practice mantra, is two things that I always like to tell patients is the first thing is, why live in pain even one more day? If there's something you can do about it, why are you putting it off? And then as a practice, kind of our philosophy is we treat the problem, not the symptom. Because if you're going to just keep treating symptoms, then we're going to do this forever and ever and ever. So we are a little bit more specified into actually finding what's causing these types of issues. Then we can create a plan to actually correct them as much as possible. That way we get some actual results, and we can actually look and chart the results too, so we know where we're going instead of just kind of doing this and this and this. And that's what, unfortunately, some people are just so used to, whether it be from, other doctors they've been with, and especially more of the, primary care doctors and stuff. They go in and they tell them, I have XYZ. Well, they don't treat that. So the only option they have is to either say, here's a weak prescription of some medication, or go see a PT, or basically just kind of get out of my office because I don't know what to do with you. And they kind of just get in that cycle of, they're not getting any better. They're just putting these Band-Aids on things. Let's actually take the time to figure out what the problem is. Because if we can restore functionality and actually get everything moving and operating the right way, then we're not going to be able to have these symptoms. Because it's a cause and effect, the cause is whatever the issue is, and the effect is the symptom. So if you just keep changing and chasing symptoms, you're covering things up. Your body's just going to keep compensating, and you're going to develop new symptoms as your body's getting worse and worse and worse.
Yeah, I think you're spot on, man. And the health industry's become pretty darn lazy when it comes to actually delivering like solutions to people, and they just want to pass people around. And they're like, when it really gets any better. That's why I love chiropractic, because when people come in and see you, you do a proper exam. You do a proper report of findings. You tell people what's wrong. You tell them how much concern there is. You tell them how you can help them. And then the solution is come in and see us and we'll make improvements. And, there's no guarantees with anybody's health if they're not active participant, but you actually get a chance to give them the option to participate with you. And that's the thing is, like, people that come to a chiropractor and make that a part of their routine of life. I always tell people this. I've never met anybody that had a chiropractic lifestyle that's life got worse. Like, I've only met people that practice the chiropractic lifestyle that's lives have improved. And I can't say the same about the cut it out, drug it out, burn it out model. Like, I can't tell people that if they go get something cut out that they can go back and have the same body they once had, or if they go and get something surgically repaired that they can go back in time and become the person that they were before that. Or, the other part of the story is I've never met anybody that took more medications that had a really more awesome, vibrant life than somebody that wasn't on more medications. So, with chiropractic, you don't add anything in or take anything out. You just remove the interference. And that's something a lot of people don't really understand. They can't comprehend that because they don't understand like nerve on bone, and they don't understand like removing pressure on nerve on bone. They just think that there's going to be something that they take and miraculously they're going to feel better. But they have to be an active participant. And the medical system has become very, very lazy, in my opinion. And chiropractors are not lazy. You guys look for the solution and you want to make people feel better, and you want to see like outcomes and better improvement in people's, as you call them, activities of daily living. Like you want to improve that stuff. And I think that that's why when people are in those types of, trauma care, the other medical industry is really great, but they should always be co-managed with somebody that is a chiropractor that wants to make sure that there's no opiate addictions and that people are recovering quicker. And I think that you building relationships with those personal injury attorneys is only going to help your community more, because they're going to start sending people to somebody that isn't interested in the pharmaceutical industry. You're interested in, care management of getting people better. And I think that it's very honorable to see that you're doing that work and building those relationships. So I just want to commend you for doing such a great job of being a chiropractor and being a pillar in your community.
Thanks. Well, there's a big point there, and this is where a lot of people get unfortunately sucked into this like negative feedback system is, if they have an injury, right, and they go to the hospital, if it's something major, broken bone, concussion, tears, their arms hanging off, that's perfectly what the hospital is there for. However, if they have an injury and they don't find anything on the x-ray, they don't find anything on an MRI to mean where they need surgery, they just kind of pass them off and say, okay, we'll just call this a sprain and you'll get better. But they don't get better because there was more going on than they actually thought to look for. And, one of the biggest things is that people after an injury, they go to the hospital and then they're not getting better. So they come to my office and I ask, did they take x-rays? And they say, yes. I said, well, did they take x-rays of you laying down, sitting, or standing? And if they say they took x-rays of their low back sitting or low back laying down, those x-rays only looked for fractures, but we can't see any other changes because they weren't weight bearing. Like that doesn't make any sense. You don't live your life sitting down or laying down. So why are we looking at the problem when you're not doing the function that you're having pain with? Like to me, it makes common sense. So looking at those things too, now we can actually find problems that they didn't deem, extremely needing immediate care because they weren't life-threatening, but they will develop chronic injuries. They will have problems for the rest of their life, and they will start getting worse, and they will start, spreading throughout their body because they were never diagnosed. And it's all because that model is not made to look for those things.
And, I'm just going to touch on this a little bit with you too, is you've probably never had a patient come into your office that sat there in the waiting room for 3 hours.
No.
No. But if I were to be in a car crash and I went to the emergency room, there's a good chance if I wasn't bleeding, I would sit in that waiting room out there in the ER, like waiting room for possibly 3 hours, maybe longer.
Oh yeah. You're going to be there all day.
Yeah. So when somebody comes into a chiropractor, they're going to get an exam, like I said, a consultation, a health history. You're going to do some orthopedic testing. You're going to do a proper set of x-rays. And you're going to do what chiropractors do so amazingly is a recommendation of care. And when people come back in, you're like, well, these are the things I found. I call it the relationship builder. Chiropractors know how to build a damn relationship, and they know how to help people. And that's why the referrals are so heavy when people start getting under care. That's why, the kids come in and the husband will come in or the wife will come in, the grandma will come in, and you build a practice because you do right by the community. And I think that that's something that's so, we need to talk about more within the chiropractic profession, because when you do right by your patient, they do right by your business, and they want everybody in their family to feel better. and they want people to have, better quality of life. And I think that that's why the chiropractor keeps on winning, and people keep on, getting better quality of life that go to the chiropractor. Because it's not always, like you said, it's not the pain. It's the underlying concern that causes that pain to trigger. And that's what chiropractors go for. It's not the tip of the iceberg. It's what's underneath the water that chiropractors help with.
Right.
And I could go all day about this type of care, but I fall in love with the idea that chiropractors are care providers. They're not in the healthcare system. They're in the care of health system. And I say this time and time again, but I think that chiropractic got swallowed up by the healthcare industry when it has zero to do with the healthcare industry. Chiropractors are a standalone profession that look to the body for vertebral subluxation and correct that and remove the interference in the nervous system, allowing the body to heal naturally. And there's not another group of doctors on the earth that do what chiropractors do so effectively. And that's why chiropractors still keep on winning time and time again. So congratulations once again for doing what you do. I'm fired up and excited just because I know that we're making a change and we're making a difference. And people are so confused by what a chiropractor really does. You're not headache doctors, damn it. You're nervous system doctors. Headaches are a byproduct of a nervous system being out of alignment. So, or, I'm not a clinician, so I can just tell it from like a layman's perspective is, you're not headache doctors. You help with headaches, but really what you do is you remove the interference on the nervous system, allowing the body to function normally or the way it should. So
how do you think the world would change if every person on the planet started seeing a chiropractor and getting checked and adjusted?
I think that one thing is we'd see a huge decline in osteoarthritis. We'd see a huge decline in degenerative disc disease. All of these things that are chronic things that take, years to start developing. Because if we have proper functionality and movement of joints, of ligaments, of tendons, if we're using muscles the right way, we're not going to have scar tissue buildup. We're not going to we're going to have less injuries because our body's able to actually deal with things better, and we're not at a lower rate when we have that injury happen. So, we'd definitely be a lot better off. And part of that too is just, if you look at a lot of the best athletes in the world, they're getting adjusted because they know that this is going to help them not only increase reaction time, increase healing time, prevent injuries, and allow them to function at their highest, but they're looking to do it for long term. They're not looking to do it for 2 years. They're looking to do it for their whole career. And they don't want to be, after they're done with this, have all these issues. So, if we're seeing some of the peak performers in the world are using chiropractic to stay healthy and to work at their best, I think that might be the best inclination there might be something to that.
Well, I think it even goes beyond that. I think that people that are like, the other athletes that no one talks about are horses, and every horse out there is getting adjusted.
Yep.
And horses, they don't talk, obviously, so their performance is all about the alignment. And when we're talking about structural alignment, like everybody that has like a top dollar horse, they're getting those horses adjusted. So when we're talking about the athletic performance, you can tell from like a human performance level, like when somebody got injured and their ability to recover quicker because of the chiropractic adjustment. Yeah, that's obvious. But when people are like, I don't even know how much a top of the line horse costs, but when they're getting those things, when they're getting their animals adjusted because they want top performance, it makes sense. Like if you would take care of your asset that great, why wouldn't we take care of our own assets that great, which is the human that's behind that? And I really believe that, every sports team out there has a chiropractor. Yep. And they would be remiss if they didn't. And now they'd be looked at like, why don't you? And, probably 10 years ago, that wasn't the case. But now we're moving into that era that people want to take care of their assets. And that's the winning team. And if they're going to have the best team of doctors taking care of their team, they want to have a chiropractor doing that. So I see where that is becoming more and more co-managed, type of a medical brand within the world is, yeah, if the chiropractor is on the team for like a high performance, athletic performance team, or taking care of like the top horses in the world, there's probably a reason for that. So if it's good enough for them, it's definitely good enough for the guy that works 40 hours a week.
Oh yeah.
So where do you see chiropractic heading in the next 20 years or so?
I think that is a great question. I think kind of the problem that I see with chiropractic is there's just such a huge divide. It's one of the only professions where we have people fighting amongst ourselves as to where we want to see the profession go and what we want to do. If we could just come together and decide on just even the most simplistic region or meaning of what chiropractic does, I think it'd be phenomenal, because what's happening right now is people are definitely starting to get sick of this, getting sick, getting medication, all of that type of thing. They're cutting out the amount of pain medication they're giving out at hospitals and doctors' offices. Pain management doctors aren't treating pain the same way they were because of the government regulations. So chiropractic is going to be needed to help these patients with dealing with different pain. And it works perfectly. Has to do a lot with autonomic nervous system and different things like that. Each person is going to be is just different as to what they have going on. But again, if we can just start give these people what they want something more natural that's not going to have all these side effects, to help get them feeling better, feeling good, not causing all these side effects that sounds like, diarrhea of the mouth when you start reading the side effects of medication. That's what they want. And I think we have a huge, huge amount of impact potential. I think how much potential and how much growth rate chiropractic has just depends on how much people are not willing to get together or kind of have that infighting in philosophy, so to speak.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Chiropractic Rocks, True Weight Solutions, The 100-Year Lifestyle, Pure Chiro Notes, Titronics, Passive Practice Profits, BrainTap Technology, Sherman College of Chiropractic, SCED, Chiro Pro Accounting, A-Line, and Midwest Brain Health Technology. Let's hustle. Yeah, I think you delivered the message really clear there. The more that the chiropractic profession supports the chiropractic professions, the greater of impact that the profession will have long term. And
yep.
I think, obviously you can't go back and change philosophy, because philosophy was founded way before any of these people that are practicing chiropractic right now existed. So The science has evolved along with technology. So the philosophy is definitely rooted. The profession's definitely rooted, and there's nobody out there that's been around since the beginning of chiropractic. So obviously things are going to evolve, but if we want to see the chiropractic profession going in an amazing direction, there has to be some unification. And I've always said that we have to have unity through diversity, because if I go see your clinic and I go see 5 other chiros in your community, everybody does chiropractic a little bit different. So those that live in glass houses don't throw stones. And those that, are in the chiropractic profession should support one another rather than saying you do it wrong. And I think that that's something that can go a long ways with what we're saying today. Is chiropractic in 20 years will be a massive profession, and it will be built on your shoulders. And as they say, you stand on the shoulders of giants. Well, those futures are going to stand on your shoulders. And if we can do it the right way, chiropractic, I've always I was a futurist coming into chiropractic when we did 12 years ago, because I knew that chiropractic eventually would win big time. And chiropractic is going to be like saw out. Like people are going to be like, you're not going to see the chiropractor, you're crazy. And and that's where I would like to see the profession going, is like, you don't have a family chiropractor? What's wrong? Like, what are you doing? Like, don't you know that those are the people that like make people like feel better and help with like, the cause and not the symptom? And don't you know that those are the people that like make communities better and more healthy? It's like, it would be like saying that you don't like go to the dentist. Like, you're nuts. Like, what are you doing with your teeth? You're just like leaving that to your own, like, I guess. But, you know, when you think about like the future, like if chiropractors all support each other just a 10% more, we would see the profession going in a way better direction with unity. So I'm spot on with you.
So who have been some of your heroes on your journey to be where you are today?
That's interesting. I think I always kind of have always kind of had a kind of a special place for the people who have been able to create a vision and then be able to build upon that and build upon that. I always kind of admire what they were able to do. You know, even talking about people like let's take Walt Disney, for example. I mean, just look at what he was able to create and how he was able to do it. At the time, no one thought it was legitimate. You're going to create this theme park and you're creating this animation studio and you're doing these things that have never been done before. But he just kept persevering, even though he was told no, 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 all along the way. And then now, I mean, if you told anyone, you know, someone who's under 30 and didn't know about the backstory, if you told them, yeah, Walt Disney was actually considered a failure for a long time and was laughed at, they'd be like, you're crazy. I mean, I see Walt Disney movies all over the place. They've got their own streaming channel now. So it's kind of interesting with that whole thing. And then too, just to be able to, you look at companies like Apple or even like Amazon or even like Tesla, to where they have this vision of this is what we want to do, but this is the starting point. I'm not going to stop here. I'm going to then build on top of this. And it's all about trying to make not only, you know, their vision come to pass, but make the world a better place and make people have a more enjoyable life and atmosphere because of their vision and where they want to go. I mean, I think that is just so amazing, and just learning kind of like how they were able to get through it all. I mean, because we all deal with those times to where it's like, hey, things aren't going the right way, and we deal with all these kind of trials and issues and all these kind of road bumps and roadblocks that we have to go through. I mean, but to look at just how you can get there, I think that's pretty amazing. So people who can persevere like that, like those people are really, really, I hold in high esteem.
Yeah, funny thing about Walt Disney's, a lot of people don't know he had 7 failed animation studios before he finally took off.
Yeah. I mean, and that's just crazy if you look at what happened and where it's at now. I mean, it's almost unbelievable. And I mean, we don't even talk about some of the failures that he had, like the Euro Disney closed down. No one even talks about that because everything else has been such a big success. I mean, everyone wants to go to Disney World. I mean, you've got athletes saying I'm going to Disney World after they win the Super Bowl. I mean, to think that he started out drawing these little animated characters and failed all those times. And now you got professional athlete, grown adults saying they want to go there, and then basically setting the stage to create cinema as we know it, to create this whole thing that, you know, Kevin Feige's now doing with the Marvel universe, to not just create standalone movies, but to create a franchise of however many movies they're going to get that all interlock, but can then also be seen alone. I mean, just the vision to be able to do things like that is phenomenal.
So if you could pick anyone from history to sit down and have dinner with, who would you pick?
Ooh, that's interesting. Anyone throughout history, huh?
Mm-hmm.
You know, one person I've always kind of thought would be interesting to kind of talk and pick their brain about would be Bruce Lee, because he came over here from another country, was dead set on doing what he wanted to do, bringing over his style of martial arts. You know, he's a smaller guy, was told he was never going to make it, started out, you know, at the bottom and worked up, and not even knowing the language as well, adding in another factor. I've watched a couple of his interviews, and just the way he's very articulate, the way he kind of talks about his theory of what it is to be part of the Jeet Kune Do, and very, very interesting. So I'd definitely love to talk with him and get more information about that.
You know, thinking about that, he trained. He was an artist, and that's a part of chiropractic is art. And that's a part that most people don't really focus on and discuss. But chiropractic is a science of philosophy and an art. It's a healing art. And I think when people think about technique, that's been one of the things that has been like kind of a rift within the chiropractic profession is I do this thing and I don't do that thing and you do that thing and that makes you different. But really, I think that that's what makes chiropractic beautiful is because people have so much different technique and they find their own philosophy around that technique. And when you think about martial arts, chiropractic is a healing art. So I think there's a lot of symbiosis when you're talking about this. And, you know, a lot of people don't know chiropractic till they get to college. And all of a sudden they're in college and they're learning a new art. And that's a part that most people don't discuss. So I think, you know, bringing it back full circle, science, philosophy, and art, those are definitely some things that we can move forward with in the next 20 years that will make the profession stronger if people just knew that chiropractic was a healing art and it wasn't a symptom chaser. And I think that the marketing arena has turned chiropractic into symptom chasers. And the medical industry is like, no, you guys just help with neck pain, back pain, and headaches. Screw you guys. But that's not true. But that's what it's been reduced to because people have lost the ability to communicate that chiropractic is it's a healing art. So I think that that's going to be something that will pull us forward rather than hinder us. And then people have a lot more appreciation for each other's techniques because that's how things start to thrive again is when you start to pay attention to the history and you start to have a resurgence in the strength of what chiropractic really stands on. So Bruce Lee is a great analysis for the chiropractic profession if they just studied what he did, because he was just a guy that he was like a Clarence Gonstead. Like the guy like lived at his clinic and he adjusted as many people as he could every day. And Gonstead to me was like the chiropractor of like Walt Disney. He's like, I'm going to create an airstrip. I'm going to create a hotel and I'm going to create a chiropractic like movement where people can fly in and see me. And I think when you have that big of a vision, a lot of people have become drawn to it because they're like, I've tried everything else and everything else has failed me. Well, you know, the Gonstead technique is one of the strongest ones in the profession. So just to know that Gonstead did something amazing, we're bringing it back full circle now. I think he was an immigrant from Northern Europe. And he came over here and decided that he was going to start a chiropractic movement. And it's just amazing what we're able to accomplish if people just support each other a little bit more. And I think Bruce Lee is a huge idea when it comes to the technique of what chiropractic really stands on and how we can actually get chiropractic more universally understood through the idea of technique and philosophy. And, you know, marrying that with now the analysis. I'm sure that, you know, anybody watching this that's ever heard of chiropractic knows that chiropractors are like leveraging, you know, thermography and they're leveraging x-ray. And when you can like correlate thermography with x-ray, now you have more science of proof. So the analysis becomes even that much more great. So, I think what you were talking about today is essential for the chiropractic profession to hear, but it's essential for everybody to hear because it's a deep profession that a lot of people have boxed into. How can we market it better? Well, you market it by telling people what chiropractic is, not what it isn't. So that's my 2 cents on that. Going into marketing though, what do you like doing? What's worked for you historically?
Well, you know, historically it's been different in the last year than it has been before, but I really like talking with people. I like being able to be personable, kind of have that connection. The biggest thing is that everyone has their own individual story. So anytime I can talk with people or at least give them a little bit more attention than, you know, just saying, you know, you have a headache, come and see me. I want to get into a little more detail and background. Because one of the things I find too is that a lot of the patients, when they'll come in, they'll tell me, okay, this started, you know, a week ago. It didn't start a week ago. It started a lot longer ago, but they didn't put the connections together. So when we start talking and figuring out, okay, well, you know, tell me about this. Have you ever had this before? Well, I did, but it went away. Okay, so what we're hearing is that this all started actually 3 years ago. It healed okay, not 100%. Your body started compensating, so you didn't notice the pain as much. But that compensation, because we're now putting abnormal pressure and using muscles and tendons differently, we started to actually have some degeneration that went on, which is why now when we look at the films, I'm seeing osteoarthritis, which takes years to set in, doesn't take a week. So this is actually more of a new symptom of the original cause because you weren't properly evaluated and treated before. So it's kind of getting the whole story, so we can kind of figure out what's going on. So I like anything where we can talk with more people. So I like doing workshops, any kind of event where I can meet people, because I think that's the most effective. So those are what I kind of prefer. I don't like, just mailing stuff out and doing anything like that.
What would be some advice you would give to a chiropractic student who might be listening to this and just needs some advice?
I think, there's a couple things, and just kind of going back on what I've learned and how I've changed kind of from when I was in school to now. First of all, I think that you just have to understand that, like Jim was talking about earlier, your technique's going to improve the more that you do it. So you're not going to be the best adjuster when you just learned that technique 2 days ago. So it takes practice, and you have to stay resilient with it. And then you have to find something that resonates with you. There are lots of techniques out there. There's lots of different philosophies. Find which one you identify with the most or makes the most sense to you. And then that's where you should go. Don't go with one that's just pushed on you. There's so many different adjusting techniques out there. You can choose which one you prefer based on what resonates with you. And I know for me, like I use a couple different ones. I don't use just one, and I use a combination, and I have different options because that's what I felt worked best for me. But the nice thing about chiropractic is that even though there's all these different techniques and there's different procedures and philosophies, is that at the root of it is still chiropractic, and it still works, and it can still get good results. It's just how you want to do it. And then also, if you want to have a specialized practice, you want to have more of a niche practice, like let's say you want to have a pediatric practice, or if you want to do more personal injury, or if you want to work with athletes, all of that's totally fine. Just figure out what works best for you and then make a plan as to how you're going to get there. Because you're not going to be able to just say, you know what, I'm just going to rent this space here and then I want to be a pediatric chiropractor and everyone's just going to come to me. It doesn't work that way. So you're going to have to start networking, creating those connections, but make sure it's the connections you want. If you want a pediatric practice, don't start talking to team managers and scouts. That doesn't make any sense. You're not going to get the right kind of patients. And the other thing too is it's okay if you want to change. So if you start out wanting to be a family doctor and then finding out through it, you just work better with this other kind of population, that's totally fine. It's okay for you to treat the people that you want to treat because there's lots of other doctors out there. And if you are not passionate and you are not there all in to help that specific patient, it's going to show. You're not going to be happy. They're not going to be happy. So it's better just to refer them. So make sure you do what's making you happy, because I can tell you, if you walk in and you smiling and you want to be there with that patient and you give them their all, like it is contagious. And that is part of the reason why chiropractic has such a high consumer rating compared to other doctors, because we care. And we're there. We know the patient's name. We see them throughout the whole treatment process to make sure that we're getting the results that we want. So you want to make sure that you're there with the right people you want, doing exactly how you want to do it.
Absolutely. Chiropractic's concierge care. Like there's no case that's the same, and there's no body that's the same, and there's no person that's the same. So each person gets a specific set of checks and adjustments. And I think that that's something that, if you market to everybody, you have a practice that gets them all. And I've seen those. I've seen the ones that just say, hey, I don't care. Send anybody in. I'll take the PIs. I'll take the babies. I'll take the whatever they call it, Medicare. I'll take any group of people. And that's the type of practice that you get. You get a community style practice. And I think that, when you do niche it down, you say, no, I just want to work with these types of cases. That's also very important. So just knowing what lane you want to be in and what types of cases you want to manage and what type of people you want to attract, that becomes your vibe, and that becomes your tribe, and that becomes the business that you grow. And I think that that's so important for longevity of practice because, if you do want to just have a sports management team that you type practice, then you're going to have like a lot of athletes and you're going to see their kids and you're going to see their kids become athletes and become professionals and stuff like that. So it just depends on what type of practice you're going to grow with. And like you said, just don't beat yourself up if you decide you start something and you want to go a different direction. Just know that whatever decision you make is your decision, and you're the decision maker, and you're the doctor, and you're the one covering the overhead. So
Right.
build the practice of your dreams, not the practice of what everybody else tells you to do.
100%.
So how do you feel about students trying to pick schools based on geographic location?
That I think is probably not the best option. I mean, you wouldn't pick a college based on geographic location, so you shouldn't pick a chiropractic school based on that. I think you need to do a little bit of research. There are, schools that are considered better in certain techniques than other ones, some that don't teach certain techniques and philosophies. So you should do your research and see which one kind of resonates with you, because they all are a little bit different. And that's one thing that, the ones, if you just pick it based on geographic location, there's also a very good chance that you're going to end up transferring because it's not the fit that you wanted. You might get lucky, but just like anything else, if you're going to spend, almost 4 years there, you want to make sure it's the right decision. You don't want to just go there because it's close. That's not what we would do for undergrad either. So make sure it's the right decision, and make sure it's the right decision based on the kind of doctor you want to do or you want to be, or what things you want to learn. But that's what it should be based on.
Well, I think this question is so important because a lot of people don't understand that there's multiple chiropractic colleges out there. And they're like, yeah, I just went to the first one that like somebody told me to go see because they're my chiropractor and that's where I went. I hear that all the time. And people don't realize that there's a selection out there. But, I think that it's just awareness is number one. And a lot of people won't refer to certain schools that are doctors anymore. So we're finding a select few that are on one hand that people will say, go to that place. So I think a lot has to do with how those colleges interact in the marketplace too, as to how they will become referable. Like, so the chiropractor who is in the front of the line definitely has a say on who shows up to which schools these days as well. So I think a lot of the responsibility is based on that institution to do right by the profession too.
Yep.
So what kind of things do you like to read and listen to, and what are some of your hobbies? What do you do for fun?
So I'm a really big sports fan. So from the Tampa area. So been a great year for me and the Tampa sports. We just won with the Buccaneers. We won last year with the Lightning. Lightning looking great again. We had the Rays in the World Series. So it was a great year for Tampa sports. I've been very happy about that. So I like to follow those things. Also, I do like to read a lot. I kind of go back and forth. I'll read some business books, but I also like a lot of medieval fantasy type books, like the Game of Thrones type stuff. So I get big into those. One of my favorite authors is Brandon Sanderson. He's got a plethora of books out, and the way he does things is a little unique, and I like that. So you kind of back and forth. I sometimes I just like to take my mind off of the business side. So I think it's always good to give yourself a break and give yourself that kind of imaginative aspect too, because I know sometimes after that gets me fired up as well. And then it gives me a different perspective once I get to the office of how I want to, do things, because I wasn't just bogged down with learning for 2 hours before I got in. But then sometimes too, I know, like I don't know what it is, but for me, some reason, after work at night is when I like doing more of the business training, chiropractic training stuff. I love taking those notes at night. For some reason, that's when I get fired up, and then I go into work and I got all my notes. So everyone's a little bit different, but for me, that's what kind of works.
So what are some websites people can go to if they want to learn more about you?
So you can go to a couple different places. My actual business website is chiropracticdownersgrove.com. That's my office that I'm at right now. I also do a training for chiropractors to teach them how to work not only with personal injury, but really it's about the relationship management with personal injury. So how to work with attorneys, how to work with doctors, orthos, neuros, how to work with the community, because personal injury is a very different beast than every other kind of patient you're going to get. And if you don't understand how to work and how those relationships work, it's just not going to be successful. So that website is morepireferrals.com. And I go through kind of the training and how that works there. And that's one thing that I just wish more people would be aware of is when you're in an accident, there are better doctors, there are better attorneys. And I will tell you right now, from what I've seen, most of the time, the problem is going to be with some of the attorneys, not so much the doctors, because the attorneys aren't looking out the best for their clients. And that's upsetting. So part of it too is helping the doctors kind of train these attorneys on how to do personal injury a little bit better as well.
Awesome.
Well, Dr. Mike, thank you so much for spending some time with us today. I think this is one of my favorite episodes just because we got a chance to be full rounded on our conversations of the profession. We got a chance to meet you. We got a chance to tell your story. And it's been such an honor to break digital bread with you.
Yeah, this was great. Thanks a lot, guys.
Is there anything we didn't ask you that you wanted to talk about?
Well, I mean, I could talk for days about all this stuff. So I think we covered the basics.
Okay, never mind. Well, Dr. Mike, it's been a pleasure having you on today. And thanks for jumping on the show with us.
Yeah, no problem.
Yeah, and I look forward to building a great friendship in the future as well. We come through the Midwest quite often. So Luke, his family's still in Illinois and my family's still in Iowa. So Chicagoland isn't too far of a stretch for us.
No, not at all.
All right. Well, have a great afternoon and keep on serving, brother.
Will do. Thanks a lot.
All right. Talk to you soon.
All right. Bye.
Bye. Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.